Hello and welcome to Retreat You, the podcast where we break down health and wellness topics to make them super simple and easy to understand. We're all about giving you the knowledge you need to take care of yourself without the confusion. If that sounds good to you, so share this podcast with your friends and family and make sure to hit that subscribe button so you never miss an episode. Okay, so today we are diving into a topic that, let's be honest, is way more confusing than it should be. Your dental routine. You see commercials showing one order, you read a blog post that says another. Should you floss first, brush first? Where does mouthwash even fit in? It's a lot. That's why I'm so excited to have an expert with us today to clear it all up. Please welcome Whitney, a wonderful dental hygienist who is here to help us build the perfect routine. Welcome to the show, Whitney.
Hi, thanks so much for having me. And you're right, it is a huge point of confusion for so many of my patients. I'm happy to help set the record straight.
I'm so glad because I feel like my bathroom counter is overflowing with products and I'm not even sure if I'm using them right. The big one for me is mouthwash. It feels like this mandatory, super important step in every TV commercial. Is it really that crucial?
That is the perfect place to start because it's one of the biggest myths in dental care. For most people, and this might be a surprise, mouthwash is not a necessary step.
Wow, okay. So all that intense swishing we see on TV is just for show?
Pretty much. If you have a healthy mouth with no major issues like gum disease, you really don't need an antiseptic mouthwash. The core of a healthy routine is physically removing the plaque and bacteria, which are brushing and flossing. Mouthwash is more of an accessory.
Okay, so what if you're like me and you just like the feeling? You like that fresh, clean feeling it gives you. Is it bad to use it?
Not at all. If you genuinely enjoy it, that's fine. The most important rule is when you use it. If you're using a standard alcohol-based or antiseptic mouthwash, you should always use it as the very first step of your routine. Before brushing? Exactly, before anything else touches your teeth. The reason is that many of these mouthwashes can be a bit acidic, and you don't want that to be the last thing sitting on your teeth. You want to swish with it, spit it out, and then move on to cleaning, which will neutralize everything. We can talk about the other kind of mouthwash, the anti-cavity ones, later on because they actually go at the very end. This is already so helpful. So mouthwash is an optional first step. What's next? This is the big one, the great debate online. Do we brush or do we floss first? The great debate. Honestly, as dental professionals, we are just thrilled that you're doing both. The clinical difference between brushing first or flossing first is so tiny that it really doesn't matter. The most important thing is that you are flossing correctly once a day. Okay, that takes so much pressure off. But I'm curious, what do you personally do? I'm happy to share. I'm a little more prone to getting cavities, so my goal is to get as much fluoride from my toothpaste onto every surface of my teeth as possible. So I brush first. I brush thoroughly for 2 minutes, and then I spit out the extra toothpaste, but I don't rinse with water.
Oh, that's another big one. I always rinse.
And many people do, but leaving that little bit of residual toothpaste on your teeth allows the ingredients, like fluoride, to continue working. So after I brush and spit, I then take my floss and I floss between all my teeth. The idea is that the floss is helping to carry some of that fluoride-rich toothpaste into those tight spots between the teeth that the brush couldn't reach.
That makes so much sense. It's like you're delivering the toothpaste to the hard-to-reach places. Okay, I'm trying that tonight. So let's talk about the brushing itself. You said 2 minutes. What else is important? 2 minutes twice a day. And a big one that people often get wrong is when to brush in the morning. You should always brush before you eat breakfast, not after. What? Really? I have been doing that wrong my entire life. Why before? It's a very common mistake. When you sleep, the bacteria in your mouth multiply. They create a layer of plaque. If you eat breakfast first, you're basically feeding that huge colony of bacteria all the sugars and carbs from your food. This creates a massive acid attack on your enamel. By brushing first, you remove the plaque and bacteria, so when you eat, there's much less there to cause problems. Plus, brushing right after eating, especially if you had something acidic like orange juice, can damage your temporarily softened enamel. Mind blown. Okay, brushing before breakfast from now on.
Now, what about all the different ways to clean between your teeth? I'll be honest, sometimes I find string floss to be a real pain. You are not alone. So many people struggle with it. And the good news is there are amazing alternatives. Floss picks, the ones with the little handle, are fantastic. They make it so much easier to reach the back teeth. There are also little things called interdental brushes. They look like tiny pipe cleaners, and they are incredible for cleaning spaces between teeth. For some people, they can even be more effective than floss.
And what about a water flosser? I see those everywhere now.
Water flossers are great, especially for people with bleeding gums, gum disease, or braces. They're excellent at flushing out debris and stimulating the gums. My personal recommendation is to use a water flosser in addition to one of the manual methods, like a floss pick or interdental brush. The manual tool scrapes away the sticky plaque, and the water flosser flushes everything out. It's a fantastic 1-2 punch.
This is all starting to paint a picture. It feels like so much of oral health is this battle against bacteria. We're trying to brush it away, floss it away, flush it away. It feels like we're always just fighting against it. Is there a way to, work with our mouth instead of just against the bad stuff?
That is such an important question, and it points to the future of dental care. For a long time, the focus was just on killing all bacteria, but now we understand the importance of the oral microbiome. Your mouth is a complex ecosystem filled with billions of bacteria, both good and bad. The goal isn't to kill everything. The goal is to make sure the good bacteria are in charge.
That makes sense. It's like having more good guys than bad guys. I was actually looking into this for the channel, and I came across a product called prodentim. My understanding is that it's basically a probiotic, but specifically for your mouth, designed to add more of the good guys back into your system. Is that the kind of thing that helps create that healthy balance?
Exactly. That is precisely the modern approach. Instead of only focusing on removing the bad bacteria, products like that work by repopulating your mouth with beneficial probiotic strains. These good bacteria can help crowd out the bad ones that cause bad breath, plaque, and gum inflammation. It's about building a healthy, resilient ecosystem. It's a real game changer for many people.
I love that idea of building a defense instead of just playing offense. For our listeners who are interested in that approach, I will leave a link to Prodentim's official store in the description below this podcast. It's a specialized formula, so I always recommend getting it directly from the source to make sure it's the real thing. It's definitely worth checking out if you want to support your oral health from a different angle. Okay, so we've brushed, we've cleaned between our teeth. What's the next essential step you mentioned?
The one most people skip, scraping your tongue. Did you know that up to 90% of the bacteria that cause bad breath live on the rough surface of your tongue?
Oh, wow. That's a lot.
It is. You can brush your tongue with your toothbrush, and that's better than nothing, but a dedicated tongue scraper is even better because it's designed to gently shave that gunky layer of bacteria off the surface. I promise you, once you do it for the first time and see what comes off, you will never skip it again. The feeling of freshness is incredible.
You've convinced me. I'm adding that to my routine tonight. So we've covered the 3 essentials: brushing, cleaning between the teeth, and tongue scraping. Is there anything else? What about that other mouthwash you mentioned?
Yes, the final optional step. This is for people like me who are prone to cavities or for anyone with sensitive teeth. This is where an anti-cavity fluoride mouthwash comes in.
And this one goes last?
Yes, this is your absolute final step. Remember how we talked about not rinsing after you brush? Well, some people just hate that gritty, pasty feeling left in their mouth. I get it. So instead of rinsing with water and washing away all those good minerals, you can do a final swish with an anti-cavity fluoride mouthwash. It rinses away the texture, but leaves behind a protective layer of fluoride to help strengthen your enamel and reduce sensitivity.
That's a great compromise. So to recap for everyone, the 3 absolute must-dos are brushing before breakfast, cleaning between your teeth once a day, and scraping your tongue. Everything else is a bonus based on your personal needs. You've got it. That's the perfect, simple routine. Whitney, this has been so incredibly helpful. You've cleared up years of confusion for me in just a few minutes. Thank you so much for joining us on Retreat You today.
It was my absolute pleasure. I'm so glad I could help.
And a huge thank you to all of you for listening. I hope this helps you build a routine that makes you feel confident and healthy.
If you found this valuable, please make sure you're subscribed and maybe even share this episode with a friend who's still brushing after breakfast. Thanks for listening, and we'll talk to you next time. Till then, keep learning and keep exploring. And comment down below if you enjoyed this podcast.